All right, I believe we are live. Okay, welcome to the Points virtual town hall with Fitchburg State University President Richard Lapidus and Provost Alberto Cardelle and Vice President of Student Affairs Laura Bayless. Thank you all for being here today. As the managing editor of the student newspaper, I'd like to start by reiterating the commitment of the Point in making accessible, important information for the student body and providing the student body the opportunity to voice its questions and concerns. This is perhaps one of the most important times in which to do so. We have a set of questions provided by the students to ask both of you, all three of you, and I would like to remind our viewers that they can submit questions in real time via the chat feature on the YouTube live stream or by using the hashtag FSU Town Hall on Twitter. I'd like to introduce my colleague and the campus news editor at The Point, Brittany Eldridge, who will be asking questions alongside me today. Let's get into our first question here today. Our first question is, what were the primary determining factors for closing campus this semester?
Sure. So first of all, thanks for having us on. Appreciate the opportunity. I think we have a pretty good cross section. Provost, of course, is our Chief Academic Officer. Dr. Bayless is our Chief Student Affairs Officer. So hopefully between the three of us, we should be able to cover the gamut of questions that you have today. So with that said, the primary determining factor for closing the campus was health and safety. That is our predominant criteria during these times. We felt we had reached a point. We had done extraordinarily well, actually, as a campus in COVID testing. We were running up until the point in which we elected to depart at a positivity rate well below 1%. And then we saw a gradual pickup over the course of a couple of weeks, and that led to the decision. In looking at the data, we kind of triangulate a couple of different points. We're not an island to ourselves. We obviously sit within the host city of Fitchburg, and Fitchburg sits, of course, in the Commonwealth. So we were always aggregating data across the three levels to see how we were performing relative to the others. And the state was seeing a rise, and in particular, at the point in time which we decided to depart, North Central Massachusetts saw a significant spike. And we were starting to see some of the ill effects from the community start to work their way onto campus. As you might or might not know, this semester, given the course configuration that we had and given the residence life configuration, we were about 2.5 to 1 off campus to on campus. And so it became problematic over time as we started to see our numbers rise.
All right, if we want to move into our next question, Brittany, if you would.
Did the Crossroads Church factor into the decision to leave campus?
Absolutely. They were not the only player, but they were a large player. There was also some significant upticks in youth sports leagues, particularly revolving around hockey, deck hockey, and the two of them created much of the early spike. I think that it's worth noting, and perhaps factors that students are less aware of. So it's not just the positivity rate, but it's also the contact rate. So who are those that are sick? Who are they interacting with, and how are those interactions tracked? And so we've seen a lot of language around contact tracing. And so what we started to see, and it kind of cuts back to your first question, is the Department of Health starting to sort of triangulate, if you will, the church goers, the youth sports, businesses in the community, and then ultimately how our students and our faculty and staff were interacting with the community, and how it was coming back. And so as we started to look at the tracing data, it did, as you point out, lead us back to the big offenders.
Is this tracing data available?
No, it's not. It's not shared. So we none of the data is. I mean, the aggregate data is shared. Yes. So you could go to the dashboard on our website and look at the positivity rate, and you could look at those individuals that have been quarantined by virtue of being considered a close contact. But beyond that, we don't get down to the specifics of who is ill and who's not ill and who they've come in contact with, because we start to violate HIPAA requirements.
So is
Laura or Alberto, you guys are more are health professionals. You want to, maybe you can give them a slightly more detailed answer of how it all works.
Yeah, I mean, I think, I mean, you answered it right. What happens is that the contact tracers from the local Department of Health start making, asking those that are come down positive, everybody that they've contacted or they've come in contact with. And what the president was mentioning was one of the trends we were seeing is that each person, as this progressed, each person then had been in contact with more and more people. And then all of a sudden it became very difficult for even the contact tracing to follow up. So that trend was also concerning. But that data is kept by the Department of Health. We don't really have access to that data.
Okay, thank you. What went into the decision to cancel spring break and add in 4 reading days to next semester's academic calendar?
So I can take it, Dr. Lapidus. So really the bigger, there were 2 major factors. One is trying to buy the campus more time between the 2 semesters, hopefully provide opportunities for everything from vaccines to the current surge to maybe come under control with the mitigation factors that are going in. And so our first thing was to try to push back the start of the semester by a week. If we did that, then we needed to find another week somewhere else to make up for that time. If we pushed it towards the end of May, that would come very close to when our contracts end for various unions. It also came close to when graduations would happen, and then start going into June, and then you start eating into students' time to find jobs and so on and so forth. So the spring break was the natural place to find a week. In addition to that, it also served the purpose to curtail the incentives for students and faculty and staff, everyone, to maybe use that week to travel and yet cause a potential other opportunities for spread. We do know that the spring semester, is longer than the fall because of the number of weeks, and so it was important to at least find the time to get the breaks so students, faculty, and staff could try to catch their breath during the time. So that's why we initially came up with these reading days, but as a result of student feedback during the governance process, we decided to call them wellness days. So they're wellness days. 4 wellness days have been included. And actually, again, after a lot of student input, we increased it from 2 originally to 4. So although it's not the 5 days of spring break and it's not 5 consecutive days, we're pretty close to providing those breaks throughout the semester.
Was there anything in specific that caused it to be 4 days instead of 5?
The finding an extra time to find the days in there, because right now, also one of the nice things by doing this is that every single day of the week has almost the same number of classes. So sometimes what happens is that a Monday or a Friday, because of holidays and whatnot, end up have fewer meeting days. And this now we're fairly balanced across the board. And if we did an extra one, we were going to have to take off another time.
All right, thank you. We're moving on to our next question. All right, what will be going on with on-campus classes and clubs in the upcoming semester? What can we expect campus to look like in the spring?
I'll start with classes, and then Dr. Bayless can cook in with both residential and clubs. And so we are expecting to start the semester just like we started the fall, slightly more online or on sync courses, about 4 to 5% more. So we probably went from 52% online on sync in the fall to about 57, 58% now in the spring. And then the slightly fewer hybrid and the same face-to-face. And the face-to-face courses are the ones that we expect: our lab courses, clinical rotations, art studios, music ensembles, so on and so forth. Those things that really struggle being remote. But that's really been the main difference. All other modalities will remain the same as we had them in this fall. We're not inventing a new modality. And we've also asked faculty in the departments to really try and to not change modalities past once the semester, as we get closer to the semester, that if courses have been selected to a certain modality and students have signed up for the course and registered for the course, that should not be changed afterwards. So, Dr. Bayless?
Yeah, thank you. And on the co-curricular end, I am anticipating that we will be very much like we were this semester in the residence halls and with student engagement and such as well. Depending on what the COVID surge is looking like, maybe it's slowed down to a trickle. Let's cross our fingers for that. If it hasn't, we may start with maybe a couple of weeks where we're not allowing student organizations to meet in person and not allowing folks to work out in the gym and those kinds of things, just so that as people come back to campus, it sort of gets settled and we're not maybe traveling as much and picking up the virus. It has a chance to work through our systems if we have it. And so right now we're really hopeful that we're going to be back and still engaging, at least in the way we were engaging this fall. The residence halls will continue to be de-densified, and the same kinds of guidance in terms of public health will be happening on campus. But we very successfully did a number of events and loosened up a little bit in the residence halls and those kinds of things as the semester went on. And so I'm really hopeful for what the spring looks like, and maybe as the vaccine gets out there, we'll be able to loosen up some. I have to hope, I just have to hope.
What process do you have for making sure that students are aware of all these changes?
Well, I think that, and I guess you can tell me, but I think we did a pretty good job of communicating this semester. Some of those messages come from me. Some of the messages come from academic affairs, and some of them are coming from student affairs, depending upon what those messages are. And then there are probably even some additionally refined messages that went to certain populations, depending upon what that message was. So, for example, we would send you a residence a residence hall message if you were living off campus or at home. So I think that we covered all of our bases this year pretty well. If there are areas where we've missed, certainly student input would be more than welcome. I don't know, either Dr. Cardelle, Dr. Bayless, so you have anything you could add to that? I think we were pretty communicative.
Yeah, we tried to communicate multiple times with I know that both we and Student Affairs sent out sometimes the same emails to try to be a little bit redundant on our communication. I know the registrar's office has sent out emails. We're going to send out an email probably next week, reminding students how to register, because we understand that maybe second semester freshman students have never registered. So we're putting together a how-to, and had they been on campus before, earlier, maybe would have been easier for them to learn how to do that. So we're going to send another refresher. So we're working, we're trying to communicate as much as possible. We try to do it by email, but sometimes we even use text to try to get messages across.
And social media sometimes as well. Yep, offices will send out their information in multiple different modalities so that hopefully we're catching as many people as possible. It makes me happy if people are like, I already know this. Oh, good. That's good.
I might also just take a minute to get a plug in for the coronavirus website pages. So on the news website, you find that in a stationary box under news. And I think every message that's gone out probably for the last 9 months is archived there. And as each additional new message comes up, that'll be the first on the news site.
Let's see. All right. Our next question actually touches on that. Brittany, if you wanted.
There were complaints with how accessible the school's COVID dashboard was, with students saying that the page was tough to find at times. If the school updates the COVID dashboard weekly, would it consider sending out an email with the updated figures every week to the student body?
We could certainly do that. I don't think it would be an issue. I am a little surprised to hear that people couldn't find it. It was a bright red alert tag that ran across the top of the page every single day, and all one needed to do was click on it. But if people would like to have that delivered, I think we could certainly accommodate that.
All right, thank you.
I guess the only other thing to add is that it does, you know, if there was confusion in terms of what students felt was currency, the data was analyzed and aggregated once a week based on the testing cycle, and it matches up, or we tried at best to match it up to both the city and state reporting, which doesn't always jive exactly on the same day. All the data is not exactly apples to apples, but it's pretty close.
I think a lot of the concern for the students comes from the fact that the website isn't always where they go. They go to the app and they check their email. So a lot of so I believe that's where a lot of the concern comes from, that it's not most accessible in regards to how they form their habits.
Okay, we can certainly accommodate that.
All right, thank you. I wanted to touch on this. I believe you touched on it briefly a bit earlier, but we wanted to ask if, despite the fact that we had to go home, would you declare this a successful semester for the university, actually taking that into account?
Yes, I would. And you know, we worked all summer on a COVID plan. to reopen the university. We put it into practice. I think we had a good plan. We stuck to it. And I think the measure of success was the number of positive cases that resulted on campus. Was it perfect? No. Will I ever be able to get it perfect? Probably not, unless we go into some sort of prison lockdown model where we are able to track every student's action and every faculty and staff member's action continuously. But we, I think, had a strong testing model. We used a statistical model that randomly sampled populations. And as I said, when we started, we had a positivity rate up until the end of well under 1%. So I don't know how much better we could have done than that.
Are there any plans at this moment in time, just to keep it focused on the general safety on campus? Are there any plans to bring health services back to campus? Some students have been hesitant, if not unable, to travel off campus for medical treatment.
Right now, health services will remain as it is. We are getting good student use at CHC for all kinds of services, both health services. We've had students use behavioral services. We've had students using optical services. I'm not sure how putting the health services back on campus creates any safer environment than if we were to go to CHC that's much more designed as a medical facility to handle people with illness. I don't know if you, Laura, you've been working with them, if you have additional thoughts on that.
Yeah, it's we're making really good progress in terms of student usage, and we are just starting every week to get numbers and the types of services that students are accessing. When we had a conversation just this last Tuesday at the Student Government Association meeting, the Chief Operating Officer came from CHC, Community Health Connections, to talk with the students and answer questions and, you know, those kinds of things. And there was great conversation. I know that there's a perception that it's hard to find or hard to get to, you know, either of the two locations in Fitchburg and, you know, the other places in Leominster and Gardner. But we talked about, you know, various ways to access it. And one of the things that I thought was actually a fantastic conversation was one of the senators who was talking about it had some questions about accessing insurance and mass health and how do you really navigate the system. And in many ways, that is the mission of Community Health Connections. They are as passionate about access to healthcare as Fitchburg State is about access to education. And so I think it's a really good fit, and that the discomfort folks feel because it's different now, I think is going to go away. And we have already seen some examples of that or some evidence of that. And so I am actually looking forward to the next, you know, year or whatever, as we see how it grows. And we're very close to having, so the university is hiring a physician assistant who's going to be on the university's payroll down there to give priority to students. And so once that person is in place, we'll do some virtual and some in-person, I hope in-person meet and greets. So the student body gets more comfortable with that person, you know, and understands the connection in a more personal way than just look at these amazing services you now have access to. And there's also this person who has been hired specifically to be your partner in your own healthcare.
Do we know when that person will be in place?
I would say it's going to be probably January when they're fully like vetted and on the premises. There's a couple of months it takes to do the certification when you move into, I don't know if it's any kind of health facility, but certainly it's the kind that's the federally qualified health center. And so I am anticipating that all of our candidates were she, so I can say that she will be in place in January. I'm very hopeful.
And do we also know how many more students have been accessing health services since the change?
I have to look at the numbers, and I don't know what you mean by how many more. I mean, just how many?
Just what I'm wondering if there has been an increase or decrease in the usage of health services since the change.
I would say a greater percentage of commuters is using it and fewer residential students.
All right. So how then will residential students be served? To get more to go, as opposed to commuter students.
Oh, okay. I am working with the marketing person for Community Health Connections, and we're doing co-branded kinds of information sharing. The first example of that was a message that went out before Thanksgiving saying, here are the safe Thanksgiving behaviors, that are recommended. We're getting ready to do a couple more communications in December, but we're really going to do a significant kind of social media press about what are the services, how do you access them, what are the things that you can get that wouldn't necessarily be the strength of what we had with our own in-house health services. How do you meet our new PA? How do you switch your PCP for the medical piece? And you don't have to switch anything for the behavioral health and dentistry and optometry and all of that kind of stuff. So starting about the week before classes start, we're going to be sending out several weeks of social media blasts with all kinds of advertising about both the kind of services and also the logistical end, because most of the concerns I've heard have been more on the logistical end and not as much about the quality of the service or the access to expanded services.
All right, thank you. Let's see. Brittany, did you want to ask our next question?
Will you commit to an increase in open communication with the student body concerning any changes and closures that may occur for the upcoming spring semester? Students should be informed with news of any on-campus positive cases or scares, not just the large ones such as the basketball team.
Yeah, so again, I'm not quite sure what you're asking for. I think that again, we've been pretty communicative, perhaps as the request was made in a prior comment. If students receive weekly emails with the dashboard, that might address the question. Certainly, we're going to communicate anything that we perceive to be larger. I'm not so sure that we would want to send out messages, one at a time when person one or person two gets ill. So maybe you can help me to better understand what it is the question is looking for as a means for me to try to better answer it.
Better ways of communicating, not just through email as well as social media.
Okay, so how would you like me to do that? So we've hit the website, social media, and email. What other choices would I have that we're missing?
While you're thinking about that, let me just add one thing about contact tracing, if I may. It probably feels like it's hard to know if I personally am at risk, if you personally are at risk, because you see, oh, look, there's 2 new cases this week. We don't know if they're students or employees necessarily. We don't know if they're in my class or teaching my class, whatever that is. And so it probably feels hard to know whether I am at increased risk. And that is the beauty, and also in some ways the curse, of the contact tracing process. It is extraordinarily individualized, and it goes into so much detail, not only just about contact, but what's the nature of the contact? How long is it? Was there social distance involved? Was there masking involved? Face coverings involved? What are the specific behaviors? And so anybody through that extraordinarily detailed process who is at elevated risk is going to have a personal communication from the contact tracing team, either with the Board of Health or the folks who are helping with that process on campus. And so the unknown, I have, until I understood what the process was in more detail, the unknown was pretty scary. Like, how do I know, if I've been exposed to somebody who might be positive on campus or elsewhere? But the contact tracing process is really pretty effective. And so folks who are truly at risk will be notified to go into quarantine and then to get tested. So it's just helpful to know a bit more about the process, I think, because that helps with communication as well.
Okay, thank you. But circling back, I don't want to suggest that I can answer that question, and the students should not have to. We would like to know if the university has conducted research on emergency communication methods.
Sure. There's a rave alert system as an example. For example, if we had an active shooter incident, we had a potential crime in a neighborhood, and you're probably lucky if you don't remember those messages. But we do send them out, and there's a formal protocol that goes out through the police department to do that. But I guess to just sort of conclude the thought, I think to use that system, we would have to have a pretty significant outbreak. I mean, we wouldn't use that system to let you know that a student in a particular residence hall got sick.
All right.
I think it's important to come back to what Dr. Bayless was saying about the nature of contact tracing. And it triggered on me because you asked that question, and that is actually using something like the rave alert or a massive communication is counterintuitive to the process of contact tracing, because you then create potential panic, you create then potential concerns from people who may not want to cooperate with the contact tracers. And that's the last thing you want, right? You want folks to cooperate with the contact tracers. And if they feel as if by communicating that they were, in let's say in a building, everybody in that building is gonna get a notification, they may be less open to saying that. So contact tracing is a balance between trying to find the people who are really close contact and doing it in a way that manages the risks and the concerns. And Dr. Bayless is absolutely correct that it may feel like you're a little bit out of control because you don't know what's going on, but you have to trust that folks that would be at risk would have been contacted by the contact tracers. And like Dr. Lapidus said, not everything is perfect for the emergency management communication system.
Great, thank you. Moving on, we wanted to talk about one of the residence halls here. There have been rumors circling of some of the Mara buildings being repurposed for the sake of isolating students. Would you be able to talk about any of these claims?
Sure, that's absolutely true, and it was a requirement of every higher education control plan in the state to have a mechanism by which facilities were dedicated, one for isolation and two for quarantining. So students that test positive have the option to remain on campus, or they have the option to go home or to go to some other safe environment. Same for quarantining. And so you're absolutely correct that a number of the MORAs were taken offline, stocked with provisions to accommodate both those considerations.
All right, thank you. Let's see. Brittany, did you want to ask our next question?
Yep. So if classes are going to be primarily remote in the coming semester, are there any plans to improve them further to make the learning experience better for students who do not take well to online learning?
Yeah, that's a great question, and I guess the overall answer is yes. We continuously try to improve our work. We have provided I think before the semester starts, throughout the semester and before the semester starts, 4 different additional trainings and opportunities for faculty to gain more understanding and more knowledge on this practice. The Center for Teaching and Learning has created a sort of a group of faculty that come together and talk about what's been working and what's not been working, and just that has generated a lot of new approaches and suggestions. And so we continuously try. I do think that this will be the second semester by which faculty have been able to now design courses to be hybrids or fully remote. And my understanding is that with that understanding comes a better understanding of what works and what doesn't work. I know that there's also been a little bit of need to help students understand the technology requirements revolved around it. Some, for instance, we heard of, especially early on, of certain platforms not cooperating with certain browsers. So now we have these in an FAQ that we hope to send out to students early on. Our advisors that work in career advising, as well as in the peer tutoring, the academic coaches, have been very involved. As you may or may not know, we have every freshman student got a peer mentor, and we have gotten a lot of good information about what were the barriers that students were facing. So we hope to be a little bit more preemptive and send some of these lessons out early on, so that students can follow up. My message to students is if it's not to wait and not to feel that they cannot ask questions or cannot ask for help. How we can help is a lot easier in the first 2 to 3 weeks of the semester than it is in the 7th or 8th or 9th week of the semester. So the earlier students reach out, this is new for everybody. So there is no concern or no shame in asking for help or asking for, listen, I'm not understanding this, or can you help me with this technology? If the faculty member cannot help you, they will point you to who can help.
So you spoke about faculty learning how to teach, but have there been efforts made to provide students with opportunities to learn more effectively online, or I suppose, will there be more efforts to provide students with those opportunities?
We can send out, once again, we do have a short module that we sent out. I believe we sent it out both at the end of the spring semester and at the beginning of the fall. We have our digital learning folks have a short module on how to prepare yourself to learn online. So we will make that available once again and get that out there.
Thank you. All right, our next question is, was there ever a consideration for this semester to move back to a satisfactory/unsatisfactory model? And will there be that consideration in the spring semester?
For this current semester, we did not do a blanket satisfactory or unsatisfactory policy because of what we ended up figuring out was there was a lot of, not confusion, but students that thought they could, but then their courses could not really be counted for us for satisfactory, unsatisfactory. Students have then changed their minds and said, oh, you know what, I got a better grade than I thought, and then decided to go back. So what we have said is that students can apply, can request to have a current class be satisfactory and unsatisfactory. The only thing that currently the problem would be is that it's past the deadline. So all the student would need to go is to go to the registrar's webpage and download a petition form, and you petition that we waive the deadline for having asked for your course to be satisfactory and unsatisfactory. If you do that, have the faculty member sign it, it goes to the dean, and then it'll go to the registrar, and then the grade will be moved over to a satisfactory, unsatisfactory. We're just going to do it on a case-by-case basis instead of a blanket approach. However, for the spring, what we're doing, and so this it may be a little bit confusing, but right now our satisfactory, unsatisfactory policy is that students have to decide by the add drop date when they want to do satisfactory and unsatisfactory. Clearly, that doesn't make a lot of sense if you think about it. So we have moved, we're putting a proposal into for a policy change so that gets moved in starting in the spring to when students have to withdraw from a course, which makes a lot more sense because at that point, the student can, sorry about that, my light went out in my office. The student can decide to either withdraw if they don't think they can get a satisfactory grade, or go for a satisfactory, unsatisfactory grade. So next semester, students can request an SU grade all the way to, what is that, like the 10th week in the semester, roughly, when it's the withdrawal period. And that'll be our permanent policy moving forward.
All right, thank you. Let's see. Our next question is, how would you respond to students who feel like they are paying the same tuition for a lesser education, especially considering that the students are using the school's facilities and utilities far less?
Well, I think that the reality of it is the cost of education really doesn't change. We put as much, if not more, into what we're doing now than what would have been before. And while I understand clearly there is a preference for one over the other, I'm not so sure that evidence or data would suggest there's a lesser quality of education and learning going on. I don't know if the academic officer wants to weigh in on that one.
Sure. So actually, I mean, I think there is good evidence that, there is good quality education and learning that can happen, that does happen online. Clearly, that's the much more prevalent on programs that are created from the get-go online. Clearly, an argument can be made that, with the quick switch, especially in the spring, that that did not happen. But nonetheless, I think that a lot of the component here is that the cost of instruction really doesn't change by going to remote versus not. A matter of fact, it probably goes up. We've had to invest in laptops for students and hotspots for students that we're making available, new technologies, new cameras, so on and so forth, so that this can be provided remotely. And those are additional costs. We don't, it's difficult, but because we're not using a classroom doesn't mean that we don't pay the rent for that classroom, right? It's not as a pay as you go for many of our facilities, for all of our facilities. So if anything, our remote teaching is an additional expense.
And we've had to buy additional licenses for various programs, training of the faculty and others. In fact, even the testing pieces and other things like that are additional expenses that we have. So if you're looking at just the way the university is functioning, in addition to the different focus in the classroom, it's not a less expensive endeavor, and it's not less quality. It is different. It is different for sure.
All right, thank you. As we move to our next question, Brittany.
When will students hear about any updates regarding their housing and dining refunds, and when should students expect to receive their refunds?
The date I'm not sure of. Clearly students will be receiving refunds for housing and dining. Do you know the dates, Dr. Bellis?
There's not exact dates, but let me explain the process. So all of the information has been provided to our student accounts office from housing, which keeps all of those records. And the student accounts office is in the process of applying the adjustment to any leftover, balances that students have for this semester, any charges that they're likely to have next semester. And then if there's any remaining adjustment money, that will be distributed then to students. It would be direct deposit if we have a financial aid relationship with you, and that's how we're dispersing your financial aid, or potentially a check being cut if we don't have any other way to do it. So we refer to them as adjustments because it's not, we just cut people a check. It's here's the adjustment in what the fee is. It's first being applied to anything that you owe, then it's being applied to anything next semester, and then a disbursement of anything that's left over and above that. And I've been using the time frame like maybe the third week of December, next week or the week after. I'm hopeful is when all of that process, you will be able to start seeing it on your accounts.
All right. And we have about 10 minutes left. I just wanted to take a moment to thank you all so much for coming today and answering these laborious questions. This is information that's essential to the students, and being able to hear it from the three of you is very important. And I'm sure our viewers out there who are currently watching can appreciate that very much. And once again, we of course thank you for coming on today.
Thank you.
All right. So moving along, let's see. Our next questions involve Aubuchon and Russell Towers, or Aubuchon Hall and Russell Towers, of course. And we just wanted to confirm, is it true that Aubuchon Hall and Russell Towers are not owned by the university?
That is absolutely correct. In fact, I will go further and say that none of the residence halls are owned by the university. They're all owned by MSCBA, which is the holder of or the administrator of bonds and debt service to the university.
Massachusetts State College Building Authority.
All right. And then off of that, with the decrease in students having lived on campus this past semester, how much of a financial strain does that put on having to pay for these buildings on the university's budget and limit the amount of resources that are available to students?
Significant. So, just like any other rental or lease agreement, the owner of the debt isn't much interested whether the building is occupied or empty. When it comes due, it comes due. So in the case of, let's use last semester as an example, the debt service came due on the buildings. And in that particular case, we did refund students significantly for the prorated money going back to the services that we could not provide. So about $3.5 million went back to students for the unused portion of their rental agreement. And so that then now becomes additional debt on top of what we owe to the university. So it's significant. And that compounds with housing and parking and all the other fees that go towards sort of balancing the budget of the university.
All right, thank you very much. Brittany, if you wanted to ask our next question.
So students and staff cannot fully feel safe and comfortable returning to campus without accurate and reliable on-campus results and data. Will on-campus COVID testing finally be mandatory upon returning to campus?
Yeah, so again, I think the first part of that question we've sort of talked through before, and as I said, we'll be committed to providing weekly updates in a different format so that you feel more informed about the numbers in the aggregate. In terms of the testing process, yes, again, the state provides a set of parameters, if you will, that are considered to be acceptable for COVID testing. Clearly, there are some institutions that are testing with much greater frequency, and there are others institutions that are testing less, and we kind of fell in the middle. The new control plan that the governor put out beginning, I think it was January 1, will require a more rigorous level of testing. And so we will be seeing testing for all resident students once a week. And we'll move from the 2 or 3 testing cycle to testing opportunities every day for students to get tested.
So just to clarify, the protocol next semester is going to be every student who is living on campus?
Correct.
Or will that also count for commuter students who have to be on campus at least once a week?
Yeah, so commuter students will continue to be randomly surveillance tested as they were this semester. Resident students will get the once a week testing, and then other higher profile or higher probability scenarios, for example, student athletes would get tested at a higher rate as well. And we have some other populations that have shown higher levels of positive results. We'll get some slightly more aggressive testing protocols as well. I will add, though, just something that I think would be an interesting conversation for students, and Dr. Bayless can talk a little bit more specifically about her interactions with student government. But along with mandated testing comes, of course, the other side of the coin, and that is, how does one enforce it? And so the population now will have to be prepared for progressive penalties, if you will, for non-compliance. And so we are working on that right now as a means of trying to put in place a fair but rigorous set of protocols so that people will comply. So 2 sides of the coin.
Do we know what these protocols may look like yet?
We don't. I mean, Dr. Bayless could perhaps give you some sense of some of the ideas that have been kicked around in student affairs and shared with student government, but we haven't formalized anything yet.
That's right. It isn't finalized yet, and I am still collecting the feedback from the Student Government Association members who are looking at that with us. But as President Lapidus said, the anticipation is that it would be progressive. And so I can tell you at every step, students will have some period of time, say 48 hours. So I'm supposed to get tested on this time as a residential student. I don't do it, then I get notified that I have 48 hours to get that test. On campus, we're going to be testing 5 days a week. If it's a Friday, you got to get tested on the Monday. And if I comply, then boom, it's done. And if I don't, then it's the next step, which would be progressively more of a consequence, shall we say. In this case, we're talking about things like maybe fines, probation, educational modules, all the way up to and including separation from campus. We've already had students who are going through the student conduct process related to lack of compliance about public health behaviors. Between July 1st and December 2nd, we had a total of 204 cases that have gone through our conduct system. And the results of that have been everything from like a formal warning to an education module that we have in like an electronic class to take about safety methods, probation, all the way up into including several students have been suspended. And so it's actually, generally we have good compliance, but there have been 204 students who have been through our conduct system related to the choices that they're making in terms of the public health expectations that we have on campus.
Excuse me. All right, thank you. Let's see, our next question, Brittany.
Students have voiced complaints over a lack of enforcement of COVID protocols, particularly in some of the on-campus residence halls. How will the university improve upon their enforcing of COVID mandates, such as wearing masks and social distancing while on campus?
So I think Dr. Bayless just answered that. I guess I will add that one, I can't be everywhere, but my impression, and again, tell me if I'm wrong, but my impression was that our campus population and our student population did a really good job this semester of self-policing. Again, I'm not in the residence hall, so I can't tell you what goes on there. I can tell you that I've been here late at night on the weekdays, ends, and when seemingly no one is looking, I still see the greatest majority of students wearing their face coverings and doing what appears to be appropriate. And then I think, as Dr. Bayless indicated, 200 plus students do go through the conduct system. So again, much like the question that was asked before about contact tracing, a lot of things that are happening are not happening with a bright light on the process and or the people that are not complying. So it is perhaps misleading to believe that nothing is taking place. If you're telling me that there's wide scale abuse and neglect for the process, then I'd certainly like to hear about that more formally. And then I guess my final thought would be that everyone has and should have the opportunity to voice a concern if they're seeing behavior that's not appropriate. So, if you're telling me that you see a regular offender that you've either approached or not approached that is not willing to comply, then please share that and we can step that up to the next level our priority has to be the safety of all. So, please, I know it's not pleasant to take someone on, and we're not asking you to do that, but you could share that information anonymously, and it can be addressed through the student affairs mechanism.
Yeah, so there's a form on the Dean of Students webpage. It'll be relatively obvious if somebody would like to report someone who is not compliant with a student who is not compliant with the public health guidance. We've also had some complaints about employees. Those don't go to me. They go to our human resources area, but we've had complaints about employees as well. And those have been dealt with through the supervisory process. What I do when I was walking around campus the other day, and I noticed one of our contractors who's on campus helping us get some stuff done, who didn't have a mask on. And I just said, "Sir, would you please put your mask on?" And then he did right away. And I've done that with students. I've done that with employees. And I invite, if I ever forget my mask, someone to do that with me as well. So part of it is we all just have to remind folks, be willing to do that. I want to also reiterate that as students and employees come back in January, we're going to remind everybody about what the expectations are. So we'll be publicizing, all right, here's our reopening plan. Remember, this is the guidance. I know the residence halls will put up signage to get that in the front of everybody's head again. If students who live in the residence halls are uncomfortable confronting each other, feel free to engage a resident assistant. Feel free to engage the resident director or the area coordinator. And I think it's a good life skill to develop to be able to confront folks. And I also still get uncomfortable with it. Like there's people in the grocery store, for example, that are doing things that I'm like, but do I always confront them? No, I find it easier on campus than I do in the grocery store. So I get that. Please engage the resident assistants, engage the resident director and the area coordinator staff who can help out in that. And let me just see, Christopher Medley, who is the director of housing and residential services, is on the YouTube channel. So he's also saying, don't forget to say this. Let me just skim what he says. I think I got everything except for the one piece that about mid-October, we stopped warning folks. So we gave, 6 weeks where there was grace, there was reminders, there was warning. And then in mid-October, we're like, no more warning. You go through the conduct process and you have a sanction if you're found responsible for violating the health policies. And it wouldn't surprise me if we come back with no warnings at the beginning in January.
All right, thank you very much for that. And then our final question here, one I think could be a quick answer, but it's important for students to know. Looking forward to the spring once more. For students that are returning in the spring, was the December 4th deadline to present proof of a flu vaccine a hard date, or will students be allowed to submit proof closer to the start of the spring semester?
Do you want me to take the lead on that one, President Lapidus? Yeah, okay. No, it was not a hard deadline. Turn it in anytime that you can, please, 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 please. I know that the Council of Presidents that President Lapidus is part of is requesting that when we have to turn in the data is actually the end of January. Right now, the governor wants the data from us at the end of December. And I'm hopeful that maybe they'll expand that so that students can continue to get their flu shots the rest of December and in January before coming back to campus. But any time between now and then, I say turn it in. And when we have to report to the governor, we'll report what we can, but we're going to continue to try and solicit that because it's a really good public health solution, to have as many people inoculated for the flu as possible. So whether we have to continue to turn in our information to the governor on December 31st, or whether we get an extension, which I hope we will, we're going to continue to encourage students to get them even after that deadline, because it's a good public health solution.
All right. Well, thank you very much. Thank you all. We appreciate the information. Through our reporting with the point and our discussions with the student body, we've learned that that the student body has leveled some of these concerns that we have brought to you today. Like I said before, it's our responsibility as student journalists to bring these questions forth and hear these responses straight from the source. So as always, we appreciate your candid responses and the number of questions you've answered for us here this afternoon. The staff of The Point will continue to cover these issues, and you will likely get a few interview requests down the road. But once again, we thank you all very much for being a part of our town hall, and we thank all of our viewers watching our stream for sending your questions along. And so this concludes the town hall for the fall 2020 semester. Thank you all very much for attending.
All right, well, thank you very much, and best of wishes for finals, and have a great holiday season if we don't see you.
Thank you very much.
Thank you. Good luck.
Thanks, everybody. Well done.